Hey guys, Chris here again. Doing another video update. It is Friday, February 19th, 2016. I am currently in a journey for my gastric sleeve surgery. Um, I'm 4 days away. 4 days away from my surgery. It's going to happen Tuesday, February 23rd at 10 a.m. I go under the knife and finally have my sleeve surgery done. I wanted to back up a little bit and explain how I got here and where I'm at. Um, Back in, I guess, about August of 2012, I started to get edema or fluid buildup in my legs. I started noticing that. That was the first sign that I was having some issues with my weight. My weight caused other health issues. My legs started getting, bigger and bigger and getting more tender to walk on and stuff like that. And eventually it progressed pretty bad to the point where it caused me to have a lymphedema. I had a severe lymphedema infection in my left leg, more personally in my inner thigh area, close to my groin area. At the time, I didn't have insurance. I couldn't afford to go to the doctor or anything. But the best I could do is go to the emergency room. But nobody could ever tell me that it was lymphedema at the time. I didn't know then what I know now. I had all kinds of different diagnoses. A lot of people were saying, it was this, that, or the other, and they were all wrong with their diagnosis on it. My health went down pretty bad because of this lymphedema mass that grew on my body. It grew pretty quickly to about the size of a large watermelon. Weighed about 60 pounds. I know this because I wanted to have surgery for it, but before that happened, I was in a 10-year marriage that ended in 2013 due to complications from my health. She decided she wanted out, and she left. And we were married for about 10 years, but it ended pretty quickly in June of 2013. We have 3 kids together, who are my absolute reason for breathing still to this day. I have a 9-year-old, 10-year-old, and 11-year-old right now. 2 girls and a boy. I see every day. They are my 100% my biggest supporters through this right now. Like I said, I went through a divorce, and finally got myself on some insurance. Finally found out that it was lymphedema, that I had a problem. That was the problem in my leg. And it was so heavy that it was so hard to walk. I couldn't hardly walk 2 or 3 feet without having to stop and rest. The pain was that severe. If you've ever had lymphedema, then you know the pain I'm talking about. It definitely is a physical pain, and emotional pain is like absolutely ridiculous as well. So I finally got, like I said, I got the diagnosis that was lymphedema, and the only cure for it was to have it removed. So it was September of 2014. I went and seen a plastic surgeon after being referred, from a urologist and everything, to see a plastic surgeon. They removed it, and also did a panelectomy on me, which is kind of like a tummy tuck, sort of. The only difference is they don't tighten the muscles on this, if that makes sense. So they cut me hip bone to hip bone and removed the tumor, which, like I said earlier, it was about 60 pounds. And it was about an 8-hour surgery. It was pretty invasive surgery. The recovery was pretty rough. It was, tough being put to sleep for so long. It was really hard on my family, especially my kids. They were really worried about me, but I made it through that. It put me in a state of depression even after having it removed, if that makes sense. I was able to walk a little bit more, but it was still painful to walk with lymphedema gone. And she did warn me that if I didn't do something about my weight, that the lymphedema would lymphedema would return. And I didn't listen. Like most people, don't listen to the doctor. I did my own thing and kind of fell into a depression and was still dealing with issues from the divorce and everything, and was just dealing with some custody issues, and kind of fell into a dark hole for a while and turned to food for comfort. That was my vice. And, I started gaining more weight. And then I noticed that the lymphedema started to come back. And they came back pretty quick. And I have one on my left thigh, inner thigh area. Like, right there where your knee bends is where it's at. And I have one on my right thigh as well. Still have the edema in my legs. They're pretty significant in size. And it's almost like, I guess the best way I can compare it is like if you tried to hold a watermelon between your knees and tried to walk. That's what it kind of, I guess, the awkwardness of it feels like. The fluid in my legs is still pretty prominent. I've taken fluid pills for years to try to drain the fluid. It hasn't really helped me at all. So I went back to see the plastic surgeon to see about if she would remove them off of me, and she didn't want to. She decided that it was time for me to seek out weight loss surgery. So she thinks it was the best option for me, so she referred me to this doctor I've been seeing since July of last year. His name is Dr. Lamb, here in the Houston area. And I've been seeing him since July. And he believes that this is going to help me with the lymphedema to shrink them down. He thinks as I lose weight, the lymphedema is going to shrink down, and I'll be able to move more. And as I'm able to move more, then they'll get smaller and smaller. I'll possibly have to have them removed for, loose skin if I can lose enough weight, from this surgery. But every day is still a struggle. I still have a hard time walking. Walking from point A to point B is difficult. The best way I can describe the pain, it's like a radiating heat pain in my legs. I can stand for a couple minutes at a time, but then I gotta find somewhere to sit down pretty quick because my knees start shaking. And it's an unbearable pain, almost like trying to walk on if you had had a sunburn on your legs and you tried to walk on them, that's the feeling I feel in my legs. Um, so I'm absolutely hoping that getting this vertical sleeve done is absolutely going to give me my life back. Um, I just wanted to touch base with everybody and let everybody know, where I'm coming from. Kind of opening myself up here. I'm kind of vulnerable. Um, I'm going to add full body pictures of myself at the end of this video, so you can see where I'm at physically instead of just a headshot. That way I can show everybody where I'm at, show myself where I'm at when I look back at this video later on down the road. Here's pretty much the part I was worried about, was like giving out my stats. I started a liquid diet about almost 15 days ago now. Before I started my diet, my highest recorded weight that I've ever been was 560 pounds. And I cringe to say that number because not a lot of people know that number. I mean, I can count on probably 3 fingers how many people actually have heard me say that number out loud. So it's tough to say that, but yeah, my highest recorded weight was 560 pounds before I started the liquid diet. I'm currently hovering around 530 pounds. So I've lost about 30 pounds in the last 15 days on this diet, which normally I would be, oh yay, ecstatic about. And a lot of people say, wow, that's a lot of weight. Well, yeah, it is. It's probably mostly water weight to me, because like I said, I have a lot of fluid on my body. But it's still painful to walk. So even losing those 30 pounds, it's still painful to walk. I'm 5'8", so 5'8", 530 pounds. When I had that surgery back in 2014, that had the lymphedema removal, actually, sad to admit, but I mean, I was actually down to 420 pounds at the time. So I gained quite a bit of weight, over the last 2 years, only a year and a half actually. So even after that surgery, like I said, it was still painful to walk. That's how much fluid I had on my legs. So I'm hoping that, if I lose a significant amount of weight, I'm hoping that this will really help me get my life back. And I need to do this. I know this is going to be a dog fight. I know this is going to be a hard journey. And I know that the sleeve surgery, from what I've read and a lot of videos that I've seen, a lot of transformations from a lot of people that I've talked to and I'm friends with now on Facebook, seems like this is the best option for me. I've seen a lot of good transformations, and it gives me a lot of good hope. And I'm hoping that, I'll be able to bounce back from this. So, pretty much I just wanted to touch base with y'all. If you want to, you can, like my video, subscribe to me, friend me on Facebook. If you want to friend me on Facebook, it's the same screen name as my YouTube name, so it's under Chris Gone Wild. Reach out to me. I'd appreciate the support and everything. So, like I said, I'm going to add pictures at the end of this video, so you can get a better idea of where I'm at. I can also have a better idea of myself. So, I think that's about all I got to say right now. I'll try to post a video or record a video of me in the hospital If I can, I'll do the best I can to try to get some video shots of me in the hospital. That way you can see my journey in the hospital as well. I'll do, and I'll post those as soon as I can. So if I don't talk to y'all anymore between now and Tuesday, I will see you on the other side. Take care. God bless y'all.